Γεια σας από την nlpgreece. Μαζί μας σήμερα ένα από τα μεγάλα κεφάλαια στην ιστορία του NLP, ο Robert Dilts, και περνάω γρήγορα στα αγγλικά για να μπορεί να με παρακολουθεί. I'm carrying on in English, Robert. Robert Dilts, in the modern world of NLP, is considered the greatest developer and modeler. If you search in various libraries, you can find all types of methodologies that provide professionals with effective strategies. But so far, there were no methodologies for how to build the mindset. Based on the basic NLP premise that success can be modeled, Robert Dilts studied the mindset of genius, successful, inspiring, and outstanding individuals all around the world. He started analyzing the genius thinking of figures like Aristotle, Mozart, Nikola Tesla, Einstein, Freud, Martin Luther King, Walt Disney. He further continued by modeling hundreds of successful next-generation entrepreneurs and leaders, among them Steve Jobs, Elon Musk, Jeff Bezos, Richard Branson. And the story, of course, goes on, never ends. He synthesized the results of his study into a unique approach, the success factor modeling. The approach further expanded to cover a wide range of challenges, needs, and applications, not only for individuals, but also for whole systems of people. Invited by nlpgreece for the Leading Minds Festival today, he will talk about the success factor modeling in healthcare, a project initiated by him and Emanuela Mazza, where our country, Greece, also participated along with Italy and France in this project. In addition, on February 25, he will conduct the VIP workshop, where he will present the differences that make the difference from poor to average to extraordinary outcomes within the spectrum, of course, of his approach, success factor modeling. nlpgreece has an extended cooperation with NLP University and Dilts Strategy Group and keeps on being at the center of new NLP developments. Robert, I have to stop here because if I keep on talking about you, you probably won't have enough time to say what you have to say. So the floor is all yours.
Well, thank you. Thank you, Alexandra, and thank you to nlpgreece for inviting me, and of course, thank you to the Leading Minds program for putting this on, this fabulous conference. And I'm so glad to get a chance to be able to share a little bit about what we're doing with the Health Success Factor Modeling for Healthcare project. And as you say, there's a lot to share, so I'm going to dive right into it. So as we see kind of by this, there was the slide there, that we're really looking at how the whole healthcare ecosystem can function in an effective way. And as you said so well, you know, the whole idea is success factor modeling is to find these differences that make a difference. Now, you can look at individual parts of this ecosystem, but to really understand what's going on, we need to look at how each part of the system is interacting with the others and what is their general approach. And so this is what the idea of mindset means. And I'll get into that a little bit more as we go through the presentation. So I'm going to go to the slides here. If we can get the slides up. I don't see them yet. There we are. Great. So first of all, you know, this is a study about what are the success factors within the healthcare ecosystem. And, This is the idea, Alexandra, as you were pointing out, that, success factor modeling and NLP too, both are about exploring this question, what's the difference that makes a difference? And in the presentation I'll be doing on the 25th, we'll be speaking a little bit more about some of these other areas, this idea of next generation entrepreneurs, collective intelligence in the form of generative collaboration, conscious leadership, and generative consulting. So these are all things that have already been studied with success factor modeling to really find these key differences that make a difference, and not only to identify them, but to show how we can communicate them and then even transfer them and teach them to others. So what do we look at? We're looking at these three basic aspects. Whenever we have any kind of successful performance, of course, it starts with achieving a particular outcome. So success is based on achievement, not only financial achievement, but achievement in many ways. And obviously in healthcare, it's achievement of health, of performing what are sometimes, miraculous cures or miraculous healings. And so we really want to look at, we start there. What is the definition of success and a successful outcome in the healthcare ecosystem? Secondly, what produces that? In order to get that outcome, you have to do something. And most importantly, and this is where NLP comes in, is, well, how are we thinking about it? What is the mindset that allows us to generate those actions that produce those outcomes? This is so much what neuro-linguistic programming is about. It's about our inner software that drives us, drives our actions. Just like if I want my laptop or my tablet or my smartphone to do something differently or do something better or do something new, I have to upgrade the software. And so this is what mindset is about. It's about what is the software that is driving the rest of that system. So this is one of the key components we were looking at. Now, we've been involved in doing this research. We actually started it before the pandemic, but clearly, the onset of this global pandemic has made the whole issue of healthcare, brought it even more into, a key focus for the whole world. And so we've been really looking at, well, what creates this effective healthcare, especially in these times of great challenge, sometimes uncertainty. And so we've been through a couple of years now. And of course, as you were saying, Alexandra, as Alexandra was pointing out, we've done this, it started in Italy, we've done it in Greece, in France, and also there was an international study that we did in English that was online. So we've now gathered hundreds and hundreds of data points. And we've been looking at, well, what is it, not just from one perspective, not just from a doctor perspective or a hospital administrator perspective or even a patient perspective, but from everybody's perspective that would help us to find what is a successful health outcome. So who was involved? As I was just saying, we're looking at so many different areas. Of course, we're looking at healthcare practitioners, but we're also looking at patients, their family, their caregivers, universities, research institutes, patient associations, scientific societies, health entrepreneurs, pharmaceutical companies. And so, why? What were we wanting to accomplish? As we said, identify these key success factors. Number two, organize them into a model, which I'll be presenting just a little bit. And then provide new tools to apply what that model is showing us. And then, of course, to provide support for the individuals, groups, and organizations within that ecosystem to apply those success factors. So this study is kind of in the middle. There's going to be another couple of years. We're still developing things. We're continuing our research. And the first part was an online survey where we just had people identifying what is it that you consider from your perspective to be a success in the healthcare. Number two, then we would go in a little bit more in depth in this online survey. I'll explain a little bit. We'll see how this works in the presentation. And finally, we went to a more in-depth live face-to-face interview to really say, okay, let's get specific about what some of these things are and how exactly they're applied. What are these actions? What are these key elements of mindset? So as I said, we looked over this whole healthcare ecosystem, but especially as we're focusing, we had some very, very interesting, and I think, some very, I think quite inspiring and credible participants in this study. One was this a health clinic, a hospital in Rome called CIMAD. It's a place that specializes in gastroenterology, and in fact was ranked by Newsweek to be the third best gastroenterological hospital in the world, the third best in the entire world. And in fact, it's in the top 50 of all hospitals in the entire world. So they're doing something right. And this, the founder of this Professor Gasparini, is an incredible example of this kind of shifting mindset that I think is the future of healthcare. One of the things that they did was they designed their whole hospital and all of their work with the patient at the center. And if you see this image here on the slide on the right hand, that's their waiting room. And if you look at that, you wouldn't think that's a hospital waiting room. It looks like the lobby of a 5-star hotel. And in fact, it's like that. And in fact, their view was that in a waiting room, a patient should never just be waiting. They should be learning. They should be, engaging something, and at least being entertained. And so on their walls, they have videos running of nutrition, nutritional advice. They have all kinds of things to support the patient. And when the patient goes into the room, instead of having to go all around the hospital to find different people that might be involved in their treatment, they go into one room and all of the people come to them. So it's truly a magnificent shift, and it also shows that it's viable, it's sustainable, it's profitable, and it makes a huge difference. We also interviewed one of the nurses that worked there, and they are just so passionate. The whole idea here is that when the patient is at the center, you have a patient-centric approach, and all of the mindset of everybody that's involved is there to support the patient and to bring the patient what is needed, to empower the patient, to bring expertise, to be effective and efficient. So again, we'll see that this is a good reference point for all of the other information that we were gathering from other places. Now, we didn't only look at hospitals and doctors and nurses. We also had participants in our survey from other places in the healthcare ecosystem. For example, research. And one of the participants was the Italian Ministry of Health. And they have what's called a research pyramid, where they're really trying to promote research that is going to touch on all aspects of healthcare, to really bring in all different things that make a difference. So not just the technical aspects, or the pharmaceutical aspects, but also nutritional aspects, these other areas. For example, this Professor Gasparini said something very interesting. He said that every patient should have at least 3 types of support. They should have, of course, the technical support. That means the medical, the pharmaceutical support. But he said they should also have nutritional support, especially people within the gastroenterological area. But he said another thing is they should have psychological support. Every patient should have some kind of a coach to help them deal with what's going on. In fact, as we'll see, one of our key success factors was this common purpose, a shared purpose of all the people in the healthcare ecosystem to help the patient deal with their health challenges with courage and hope. And this is so important. That's been shown to be such a key part of what actually produces health, not just to try to get rid of a symptom, but to create health and healing. So this research pyramid is really looking at how to make sure that they're kind of democratizing research, so that all of the different aspects are included. Another key contributor was the National Transplant Network in Italy. And these are people that, are, especially during the pandemic, was so challenged. It was such a big challenge. So how do you do transplants when you're worried about this global pandemic? And yet they really did that. And one of their key focuses was to make sure that they really made it clear that everybody who needed a transplant could get one, and not just people that had more influence or more wealth, but everybody. It was really, really very touching, their commitment to this. So again, this idea of each one of putting the patient at the center of the focus. Another key part of the key contributor, these are just a few examples of the participants in our study, was this patient advocacy group for patients with hepatitis C. Hepatitis C, is an illness that you can get from different things. From some people get it from taking drugs, but those drugs could be treatments in a hospital. And the treatments were, this is very touching to me, because my colleague of mine, who was my co-founder of my NLP University in Santa Cruz, California, Todd Epstein, actually died of hepatitis C. Back, this was 30 years ago, when there was no treatment. Now there's treatments, but they're very expensive, and often, again, they're not getting to everybody who needs them. And this group is making sure they go reach out to that whole ecosystem, to the government, to the insurance companies, to the doctors and the hospitals. And they have actually gotten treatment for over 200,000 people in just the last few years to make it possible for them to live, to survive. So again, we see that these are people that are doing something really significant in the area of healthcare. So those are just some examples of who we're involving. So then we were looking at some of these different success factors. And I think it's important to understand that we're looking at, in fact, what we might call our own sort of a pyramid of success factors. We start at the level of environment. And environment is the concrete place where we achieve the goals, the outcomes. So it's the where, the when, is achieved. But then, as we said, there's the actions. What do we do to achieve those concrete outcomes in health? And then here was a key part of our study that is not usually brought into other types of studies in healthcare, which is this notion of what we're calling mindset. Now, mindset has several other levels to it. There's obviously a level of what we might call capabilities. What are the skills? What is the know-how? What are the strategies that need to be put into place to guide those actions? These include things like problem solving, like communication, but also we found things that were very important were things like emotional intelligence, interpersonal skills. So these were some of these capabilities that were guiding the key actions. Then another very important part of this mindset is the priorities. Where do you put your priorities? What are the values that you are following that determine what you do first? How do you make decisions? And that goes along with belief. What beliefs go along with those values? What's important? Again, we say this has to do with sort of the why. You could say the outcomes are the where and the when, the actions are what we do, the capabilities are how we do it, the beliefs and values are why we do it. And then this level, very interesting level of identity, is who we perceive ourselves to be. How do we perceive what we would say is our role or our mission in healthcare? How do we see that role? And that's very important, because that will determine a lot about which kind of priorities you set. And then the biggest part, the sort of broad area of mindset, but we find is extremely significant, is this whole level of what we would call vision and purpose. What if in whatever part of this ecosystem we're in, what is the shared sense of purpose? What is the vision of what we are trying to accomplish? And that is what usually unites all of the different people who have different roles. They have different skill sets. They're doing different things, but they're all working towards the same, the same, purpose, the same bigger goal. So we looked at all of these things. Which of these were important, and what kinds of things at each of these levels were important? So what did we find? Well, first of all, a lot of this, another key factor in this whole area of mindset was a passion. Passion for health, passion to help the patient, passion to serve. This passion was so key. And in fact, this whole survey, we realized, came from a deep sense of passion to make a difference, passion to do something. And I just want to say that's one of the things that I share with nlpgreece, all of the people in nlpgreece, and of course Alexandra, is truly this deep sense of passion to make a difference in our world. And that's what this study was all about. How can we do that better and better? So what were some of the results? Key results. So first of all, how do we define success? So one of the things that we did was we would actually ask people to reflect upon one or several, concrete cases, not abstract, but concrete cases that they considered to be a good example of success in the healthcare field from their perspective. Track that. We knew who were the doctors. We knew who were the researchers. We knew who were in the insurance area or in the pharmaceutical area. So then we said, there was a list of statements. I think we had something like 45 different statements that you could just click on to say, this reflects that. This is what makes that successful. Some of these statements we took by looking at cues from the World Health Organization, others for things like the Centers for Medicare and Medicaid Services, others for the Institute for Health Improvement. So we really were kind of drawing from different perspectives to say what constitutes effective healthcare. So what did we find? First of all, of the 5 top of these statements that were selected, we had these 5 things here. First was there was a very good relationship and interaction between all of the team members involved. There was certainly a very clear and effective physician and patient communication, but also very effective and efficient health provider organization. Now, if you start to kind of just reflect briefly, even on just these first 3, we're seeing something interesting. It's not only the interaction between the doctor and the patient, that's important, but there's the team and the team members, and then there's the bigger organization. So it's almost like if you saw 3 concentric circles, you would see, oh, there's something that needs to happen in order for there to be that effective patient-doctor communication. There has to be support from the team. There has to be support from the organization. And then as the others kind of fit in there, that each team member knows their roles and tasks, and that all the key actors are involved. So these were, that no matter where you are in the healthcare ecosystem, these are the things that you need to make sure are happening in order to achieve an effective outcome. Now, of course, the next question was to achieve those outcomes. By the way, we characterize these, as you can see there, with 5 words that begin with E. Empowerment, effectiveness, efficiency. And by the way, efficiency and effectiveness are not exactly the same thing. They sound similar, but you can be effective without necessarily being efficient. You can certainly be efficient without necessarily being effective. You can do everything right and not get the outcome. And then this idea of engagement and expertise. So the next question was, so how, what actions are taken? What do you do to achieve those? What were the most important actions that contributed to creating that successful example? And here we got something very interesting with these actions. They were things like the protocols for communication or addressing key issues. There were protocols in place. There was a strong interrelation between professionals. There were prescriptions for responding to particular situations. There was involvement and collaboration. And there were clear work routines and procedures. So again, these we categorized in the following 5 things that happen to begin with C, which were, and at least in English, which were to communicate, to care, to co-create, to collaborate, and to clarify. So in order to achieve an effective health care goal, you have to communicate. You have to care about what you're doing and who you're doing it for. You have to co-create with others, especially in these times that we've been in where things are uncertain, where they're changing. You have to collaborate and you have to clarify. And clarifying means being active in clarifying. So then we said, okay, that seems to be a really important set of things that no matter where you are, whether you are a nurse, whether you are a researcher, whether you are the family member of a patient or the patient yourself, these are some of the things that need to happen and the actions that need to be taken. So now we get to this very interesting aspect, and this is where a lot of the NLP part comes in, which is mindset. And as we said, mindset includes several different levels here. The capabilities and skills, the values and beliefs, that sense of identity, which is about mission and role, and that sense of vision and purpose. So these we asked us as separate questions, but then we synthesized them together, as you'll see. So this was the area we wanted to explore next. And this is often the place that is so left out, and yet it's the thing that makes the difference. Nobody in technology would think that you could build an intelligent device without the software, without looking at the software, without the programming. You can't just do the action. And if you want to change the action, you've got to change the software. If you want to improve the action, you've got to improve the software. So we kind of consider this healthcare research to give us, the opportunity to look at what's the software upgrade that is going to be necessary for healthcare to really, move into this, 21st century. So we started, of course, at the level of capabilities and went up. And here we're going to kind of cluster. We had, again, 5 key areas of these success factors. The first was what we called a connector mindset, that there was a whole focus on connection in different ways. And that oriented around communication skills and the belief we are responsible for our success. So this was the attitude of the connector. We're responsible. We need to stay connected. And it was all about the bigger purpose here was expanding individual and collective excellence. So this is what we call mindset. We're looking to make connections between things, connections between people, connections between information. And to do that, we've got to communicate. Another very key part of mindset was what we called the enabler mindset. And that had to do with compassion. So this is where I was saying emotional intelligence became important. This was that key aspect of patients coming first, put the patient at the center. And this involved this goal of increasing, this purpose of increasing and a vision of increasing possibilities for treatment. Our third area was what we call co-creators. And by the way, these are not just our labels. These were labels that we asked our participants, how do you see yourself and how do you see your role in this healthcare ecosystem? What do you do? So again, another key one here was co-creators. And here the focus is on contribution. So connection, compassion, and then contribution. And here the focus was on the skill level, capability level, was interpersonal skills. On the values and beliefs level, it was, the value of innovating. It's important to innovate. So we have this idea of being responsible for success, putting patients first, and then innovating. And again, here, as we was mentioning a little bit earlier, one of the key parts of the purpose of this was to enhance the patient's ability to face illness with courage and hope. And if you've ever been a patient, or if you've been the family member of a patient, you know how important that is. You know what a difference that makes. So I think we can see that from different points of view, these are all significant. Our fourth area was what we called catalyzers. So people that make things happen, and this is this mindset of catalysis, make something happen. It's based on problem-solving skills and this belief that we are capable to adapt, and the bigger purpose is effectively overcoming challenges and difficulties, which has been such a key issue, especially these past 2 years. Our fifth and final area that was shared, those were considered some of the most important parts of this, were this area of what we called builder mindset. We're trying to build something, and that's based on competence. Now, here, what we see is that the competence comes from an interesting skill of self-awareness, and this important value of continuing to upgrade our capabilities. And here again, this whole point of some kind of self-awareness, and I think this is so important when we think about this idea of mindset, of what we call neuro-linguistic programming, is that if I'm not aware of the programming, if I'm not aware of the mindset, it runs me. I'm like a robot. I have no choice. And this happens so often, not only in our personal lives, but in institutions. Things are just set in place. They become norms. They're just unconscious things that people do. Nobody kind of re-looks at them to see, is this really working? Is this really the best way? So this to me is also a very key part of this. So we had, again, these 5 key areas of mindset: connectors, enablers, co-creators, catalyzers, and builders. And again, if you just kind of get a sense for that, you realize just how important that is. Now we put the model together, and what we see is that we go to our next slide, which is putting how do those fit with and support these different actions. And so as you see from this model here, certain parts of the mindset are supporting a couple of key actions. So this connector mindset, connection, responsible for our success, that's clearly related to communication, but also to clarifying. And that's supporting both expertise and empowerment. Whereas the enabler mindset is also about communicating for empowerment, but goes to support care. And that's where emotional intelligence comes in and putting patients first. The co-creator mindset, of course, supports care, but also the co-creating. Again, this working together, this interpersonal skills to enhance the patient's ability to face illness with courage and hope. The catalyzer mindset is about effectively overcoming challenges and difficulties, and engages problem-solving skills to both co-create and collaborate. Whereas the builder mindset, about this, developing competence, where this idea of skills and updates are essential, and works with self-awareness, helps to both support collaboration and to clarify. So our kind of simplified model looks like this. We have the connector, the enabler, co-creator, catalyzer, and builder, and they're supporting those 5 actions: communicating, caring, co-creating, collaborating, and clarifying. Now, of course, that's a synthesis. That's a model. It's kind of, as we say, okay, so now how do we turn that model into something that can be implemented no matter where we are in the healthcare ecosystem? And by the way, just to also add, that's kind of what we started with in Italy, and kind of looking at what were some of the most common things as we were gathering more information. We had several hundred people from Greece, another 100 or so people from France participating. What were some of the other key areas that showed up? One of the first was that the success definition really tended to focus on clear and effective doctor-patient communication, but which we've seen needs to be supported by other parts of that ecosystem. So then at the environmental level, what seemed to be important were the tools and technologies, and especially an environment that supports interrelations, not simply technical capabilities, but interrelations. And we see even here in these two items there, tools and technologies. That's related to what we would call the task aspect. Environments that support interrelations, that's the relationship aspect. And one of the things that we would say is that effective healthcare has to involve both the task and the relationship. If it's only the task, that's responsible for a lot of I would say, big disasters in some cases. So at an actions level, involvement and collaboration. At a capabilities level and a mindset level, but we see that there's emotional intelligence and communication skills. At this level of values and beliefs, patients come first, and we are responsible for our success. At the identity levels, it was co-creators and connectors was the most common from all these different areas of what seemed to be the key. And then, as we said, this kind of biggest vision or purpose is enhancing the patient's ability to face their illness with courage and hope. So then, as I was saying, we want to turn this into something pragmatic and practical that we can bring into that healthcare ecosystem. So one of the things that we developed based on this was a healthcare assessment tool. And the way that that works is we start with the outcomes, and we're kind of looking at if you're looking at your part of the healthcare ecosystem with where you are and what you're doing, let's look and see, are all the actors involved? Well, maybe they're not so involved. Maybe they are. Is there a very good relationship and interaction between the team members? Is there a lot of trust and rapport? Is there less so? Are people more acting individually? What about effectiveness? Is there very clear and effective communication between all the relevant actors? Maybe some are confused or not involved. Maybe they all are. What about expertise, that each team member knows their roles and their tasks? Is there confusion about that? Is that clear? And then again, efficiency. Are we very efficient and effective to support whatever the structure is that's in place? So we would do that, and of course also we're going through and assessing we say the present state of some of these actions and the mindset. And you can see here, this is a slide, but you can see that we actually have this so that you can translate this assessment into multiple languages immediately. So then we assess the desired state. What is it that I need to improve? The green here shows the improvement. Now, usually, of course, you would think we want the greens to be all 5, but the reality is that you can't always get all 5 within whatever range of time that you have. So if we're looking at 3 months or 6 months, I'm not going to be able to get them all to 5. So what are the most important places to improve in whatever short-term focus we're taking? And what we then provide is we show, okay, here's the other areas that you need to improve. Here are the actions that are going to have to be improved, and here's the area of mindset. So it's very interesting. We can show right away, and they can see, where do we need to improve most? And here we see that a lot of these areas of mindset need to be improved in this particular example. So then what do? We have developed a series of trainings, mindset trainings, healthcare mindset trainings. So, and these are of course, their purpose is to do things like achieve a higher level of awareness, to communicate more effectively, to be able to recognize and manage emotions, to increase self-motivation and motivating others, to effectively overcome present and future challenges. So we design these programs to achieve these particular goals. And just to give you an example, these are some that we actually have already started. We started them this year. We have this one that relates to the connector mindset, that's about achieving communication excellence and using communication to clarify and increase expertise and empower others through effective communication. A second one is this enabler mindset, where we're deepening emotional intelligence. We're using emotional intelligence for empowering communication and to help us and others to care more effectively. There's what we call the co-creator mindset. We're using, this is about developing expert problem-solving skills to help enable more efficient co-creation and to support more effective care. We also have this area of the competence builder, applying the power of self-awareness, developing self-awareness in order to clarify where and how to expand your expertise and how it helps you to become more engaged and collaborate. And of course, finally, the catalyzer, we call it activating the magic of interpersonal skills to be able to increase co-creativity and to collaborate better. So these now, and for each of these, we have a set of their 2-day programs where we're really going over how to do these things exactly within the context of healthcare. So they're very practically oriented. They're really, I think, important for us to transform. We can't just want to. We can't just dream about it. We like to say in NLP, you've got to go through these 3 stages of dreamer, realist, and critic. You've got to dream, of course, and big part of what this research about was creating our dream of what could be the future of healthcare, and not just as an idealism, because some people are already doing it. They're already making a difference. But then you have the realist. What is it that we need to do to make that happen? And the critic, to say, how can we do that in the best way and do it better? So you can find out a little bit more about this at the sfmforhealthcare.com or diltsstrategygroup.com. There's also the NLPU website, nlpu.com. One of our favorite metaphors that we like to use is that it's a quote from Buddha, where he said, "Thousands of candles can be lighted from a single candle, and the life of that candle is not shortened." And that's, I think, a very powerful image. And this was, when we started this research, it actually began, the idea for it began almost 7 years ago. And the implementation as it began about 3 years ago, 2-3 years ago. But it was kind of this idea of we can change things. And I think this, to me, is also an important metaphor for what leading minds is about, what thought leaders do. So we can awaken, we can inspire others without losing anything from ourselves. Just like I can light 1,000 candles from one little candle, and its life is going to still be the same. And as Buddha says, the happiness, but we could say other things, maybe health, never decreases by being shared. So this is our metaphor. We want to thank you. I want to say thank you again to Alexandra for inviting us to share this, and she's definitely a candle lighter. So, thank you for sharing your candle, Alexandra.
Thank you. Yes, we are all in here in nlpgreece. Of course, we start with the university, the NLP University, and the Dilts is the group. Yes, then big candles, and then little candles all over the world. One of them being nlpgreece, and all these, and the team per se, our team of people that we are doing all this is a little candle. And thank you.
Let's add Alexandra, that as you were saying, nlpgreece is one of our main global affiliates with NLP University. So there's a big, how do I say, there's a big connection here, and I just want to, I'm so grateful that you are here and participating in this vision.
And we know that the NLP University, the International NLP University alumni works miracles, because they communicate, they get together, they stick together. Their collective intelligence is fantastic, our collective intelligence. I mean, we share ideas again and again, and I don't know. I think we make the difference just by being together, being united. And to be frank, we are trying to do here the same. We are building up the NLP University, the Hellenic NLP University alumni. Yes.
Fantastic.
Thank you so much for being here with us. If you heard Robert speaking about the success factor modeling for healthcare, you can imagine what's going to happen for 2 hours on the VIP workshop on the 25th of February. So be prepared, stay tuned.
Yeah, what SFM is in general and how to apply it. Yes.
Yes, exactly. Thank you so much.
You're very welcome.